is looking inside her heart. These are the two upper chambers of her heart. This is her small left ventricle here. This is the bigger right ventricle that's doing the work of her left heart, most of her heart now. And then the color shows the direction of the blood flow through her heart.
We found out at 18 weeks that she had something wrong with her heart. They didn't know if it would be fixable, if she would survive. It was just, as you can imagine, just terrifying.
We did this fetal procedure when Mira was about 30 weeks gestation, and it was technically successful, but we did have some concerns later in gestation that the hole wasn't going to be big enough and that she wasn't going to do well after birth. And we were concerned that she might need an emergency procedure immediately after birth. So we had about probably 20 to 30 people waiting for her in various locations of the hospital set up for emergency procedures when she was born, not only in the delivery room, but the treatment room right next door, and also our cath labs, and also back up in the operating room in case we needed emergency bypass for her. So we were ecstatic when she was born, and she was very stable, and her oxygen levels were normal for a baby with hypoplastic left heart syndrome, which are in the 80s and low 90s. So we were thrilled. I went running into the delivery room to tell the obstetrician and the mom how well she was doing, because we were so pleased.
I don't think she could believe it either, that her stats were in the 90s, and that's why she probably yelled it like that. Her stats are in the 90s. And I was just crying. These doctors, they're amazing.
And she's done so well, much better than we ever expected. She's been one of our highest risk fetal intervention patients that we've had, and she's actually done the best. To be discharged at 2 weeks of life is just absolutely amazing.